Today we are going to talk about public health institutions and systems. Today's learning objectives are to identify the 3 core public health functions, identify the 10 essential services of public health, describe basic features of local, state, and federal public health agencies in the United States, identify global public health organizations and agencies and describe their basic roles, identify roles of local, state, and federal public health agencies, illustrate the need for collaboration by governmental public health agencies with other governmental and non-governmental organizations, and finally to describe approaches to connecting public health and the healthcare systems. So let's go over some vignettes. Vignette number 1. You go to a public health meeting and learn that many of the speakers are not from public health agencies, but from the departments of labor, commerce, housing, and education. You ask, what do these departments have to do with health? Vignette number 2. You hear that a new childhood vaccine was developed by the National Institute of Health, approved by the Food and Drug Administration, endorsed for federal payment by the CDC, and recommended for use by the American Academy of Pediatrics. You ask, do all these agencies and organizations always work so well together? Vignette number 3. A major flood in Asia leads to disease and starvation. Some say it is due to global warming, others to bad luck. Coordinated efforts by global health agencies, assisted by non-governmental organizations and individual donors, help get the country back on its feet. You ask, what types of cooperation are needed to make all of this happen? Vignette number 4, or the last vignette. A local community health center identifies childhood obesity as a problem in the community. They collect data demonstrating that the problem begins as early as elementary school. They develop a plan that includes clinical interventions at the health center and also at the elementary school. They ask the health department to help them organize an educational campaign and assist in evaluating the results. Working together, they are able to reduce the obesity rate among elementary school children by 50%. This seems like a new way to practice public health, you conclude. What type of approach is this? The previous stories reflect the responsibilities of public health agencies at the local, federal, and global levels. Public health systems are commonly defined as all public, private, and voluntary entities that contribute to the delivery of essential public health services within a jurisdiction. This concept ensures that all entities' contribution to the health and well-being of the community or state are recognized in assessing the provision of public health services. The public health system includes all public, private, and voluntary entities that contribute to public health activities within a given area. Entities within a public health system can include hospitals, physicians, managed care organizations, environmental agencies, social service organizations, educational systems, community-based organizations, religious institutions, and many others. All of these organizations play a role in working to improve the public's health. So again, the public health system includes public health agencies at state and local levels, healthcare providers, public safety agencies, human service and charity organizations, education and youth development organizations, recreation and arts-related organizations, economic and philanthropic organizations, and environmental agencies and organizations. Public health is often equated with the work of governmental agencies. The role of government is only a portion of what we mean by public health, but it is an important component. In 1994, the United States Public Health Service put forth the Public Health in America Statement, which provided the framework that continues to define the goals and services of governmental public health agencies. The goals outlined by the U.S. Public Health Service for governmental public health agencies are to prevent epidemics and the spread of disease, protect against environmental hazards, prevent injuries, promote and encourage healthy behaviors, respond to disasters and assist communities in recovery, and assure the quality and accessibility of health services. The Public Health in America statement is built upon the Institute of Medicine's 1988 report called The Future of Public Health. The IOM defined three core public health functions that governmental public health agencies need to perform. The concept of core function implies that the job cannot be delegated to other agencies or to non-governmental organizations. It also implies that the governmental public health agencies will work together to accomplish these functions because as a group they are responsible for public health as a whole. This means that no one agency at the local, state, or federal level is specifically or exclusively responsible for the essential public health services. I have mentioned the Institute of Medicine prior to this lecture as well. So let's understand a little more about this organization. The IOM is a division of the National Academies of Sciences, Engineering, and Medicine, known as the Academies. IOM was founded in 1970 under Congressional Charter of National Academy of Sciences. It is an independent, non-profit organization that works outside of government. IOM's aim is to help those in government and the private sector make informed health decisions by providing evidence upon which they can rely. Each year, more than 2,000 individuals volunteer their time, knowledge, and expertise to advance the nation's health through the work of IOM. If you want to know more about IOM, you can use the link provided on this slide. The three core functions defined by the IOM for governmental public health agencies are assessment, policy development, and assurance. Assessment includes obtaining data that defines the health of the overall population and specific groups within the population. Policy development includes developing evidence-based recommendations and other analyses of options, such as health policy analysis, to guide implementation. Assurance includes governmental public health's oversight responsibility for ensuring that key components of an effective health system, including health care and public health, are in place. The three core functions are not tangible enough to provide a clear understanding or definition of the work of the governmental public health agencies. Therefore, the Public Health in America statement defines a series of 10 essential public health services that build upon the IOM's three core functions. This is to guide responsibilities and provide a mechanism for evaluating whether the core functions are fulfilled. Under the core function assessment, there are two essential services. First is to monitor health status to identify and solve community health problems. This includes things like diagnosis of community's health status, identification of threats to health and assessment of health service needs, etc. Second service under assessment is to diagnose and investigate health problems and health hazards in the community. This service includes epidemiologic identification of emerging health threats, public health laboratory capability using modern technology to conduct rapid screening and high-volume testing, etc. Under the core function, policy development, there are three services. First is to inform, educate, and empower people about health issues. This service includes social marketing and media communications, providing accessible health information resources at community levels, etc. Second is to mobilize community partnerships and action to identify and solve health problems. This includes convening and facilitating community groups and associations in undertaking defined preventive screening, rehabilitation, and support programs, skilled coalition building, etc. Third is to develop policies and plans that support individual and community health efforts. This service requires leadership development at all levels of public health, systematic community and state level planning for health improvement in all jurisdictions, etc. Under assurance, there are four essential services. First is to enforce laws and regulations that protect health and ensure safety. Second is to link people to needed personal health services and ensure the provision of health care when otherwise unavailable. Third is to ensure the provision of a competent public and personal healthcare workforce. The fourth service under assurance is to evaluate effectiveness, accessibility, and quality of personal and population-based health services. However, the goal of all three core functions is to research for new insights and innovative solutions to health problems. This figure allows you to visualize the 10 essential public health services under the different core functions of public health. Figure 12-2 in your book provides a framework to guide our review of the delivery of public health services. It diagrams the central role of governmental public health agencies and the complicated connections required to accomplish their responsibilities. Let us now take a look at the structure and function of governmental public health agencies at the local, state, federal, and global levels. The U.S. Constitution does not mention public health. Thus, it is very important to understand that public health is first and foremost a state responsibility. States may retain their authority, voluntarily request or accept help from the federal government, or delegate their responsibility or authority to local agencies at the city, county, or other local levels. What is the role of local health department in public health? Local health department operates through two different models. The first model is called the home rule or local autonomy model, where authority is delegated from the state to the health department. The local health department or the local government has a great deal of autonomy in setting its own structure and function and often raising its own funding. The second model is called the branch office model, where the local health department can be viewed as a branch office of the state agency with little or no independent authority or funding. There are several thousand local health departments across the country. The majority of these lie somewhere in between these two extreme models. However, these models provide a framework for understanding the many varieties of department structures. The local health departments are responsible for various things such as providing immunization for those who are not covered by private insurance, to conduct communicable disease surveillance and initial investigation of outbreaks, to control the spread of communicable diseases, to license and inspect facilities, to conduct environmental health surveillance, etc. The 2003 IOM report, The Future of Public Health in the 21st Century, in conjunction with CDC, initiated the establishment of a voluntary national accreditation program for state and local health departments. This was to advance quality and performance in health departments. Through these efforts, the Public Health Accreditation Board was formed, and in 2013, the first set of health departments achieved national accreditation. The accreditation standards and measures address each of the 10 essential public health services to evaluate health department processes and services and their outcomes. Now let's talk about the role of federal public health agencies. The federal government's role in public health does not explicitly appear in the U.S. Constitution. It has been justified largely by the Interstate Commerce Clause, which provides federal government authority to regulate commerce between the states. Federal public health authority often rests on the voluntary acceptance by the states of funding provided by the federal government. This may come with requirements for state action in order to qualify for funding. The Department of Health and Human Services is the central public health agency of the federal government. It includes operating agencies, each of which report directly to the cabinet-level Secretary of Health and Human Services. This slide shows the home page for the Department of Health and Human Services. You can find various programs and services under this agency, information on funding, laws and regulations, etc. I encourage you to go to this site and learn more about the services provided by the Health and Human Services. There are many agencies under the Department of Health and Human Services. This figure outlines most of these agencies. In this course, you are responsible for the information regarding the agencies highlighted by the arrows. Table 12-2 in your book outlines some agencies that fall under the Department of Health and Human Services, their roles and authority, and their basic public health structure and activities. For example, the CDC, an agency for toxic substances and disease registries' role is to collect health data and conduct epidemiologic investigations. Please read about each agency, their roles and authority, and examples provided in Table 12-2. You will be responsible for this information on the exam. Among other federal agencies, I want to focus on the Centers for Disease Control and Prevention, or CDC, which is the key organization under the Department of Health and Human Services. The Centers for Disease Control and Prevention is perhaps the agency most closely identified with public health at the federal level. It publishes a weekly report called Morbidity and Mortality Weekly Report. CDC is a global partner in conducting research and epidemiologic investigations, in addition to working closely with states to monitor and prevent disease through health surveillance and taking an action-oriented approach to disease prevention. It also maintains health statistics through the National Center for Health Statistics, which has been part of the CDC since 1987. I have provided the web links for National Center for Health Statistics and Morbidity and Mortality Weekly Report on this slide. I encourage you to explore these websites on your own. The CDC's role in connecting federal, state, and local governmental public health efforts is central to the success of the system. Approximately half of the CDC's over $10 billion total budget is channeled to state and local health departments. A key function of the CDC is to provide national leadership and to coordinate the efforts of local, state, and federal public health agencies. Now let's understand the roles of global health organizations and agencies. Public health is becoming a global enterprise, and global governmental efforts have grown dramatically in recent years. Table 12-3 in your book outlines the structure, governance, roles, and limitations of global public health agencies. How can public health agencies work together? Coordination among public health agencies has been a major challenge that is built into our local, state, and federal systems of governance. Coordination also requires a global aspect. There are signs of hope with progress in such fields as tobacco control, food safety, and response to SARS. Collaboration needs to be an everyday effort and not just a requirement for emergencies or epidemics. There are other non-health agencies at the federal level that are responsible for promoting public health. In other words, a number of federal agencies serve public health functions even though they are not defined as health agencies. Environmental health issues are an important part of the role of the Environmental Protection Agency, or EPA. Reducing injury and hazardous exposure in the workplace are key goals of the Occupational Safety and Health Administration, or OSHA, which is part of Department of Labor. Protecting health as part of preparation and response to disasters and terrorism is central to the role of Department of Homeland Security. The Department of Agriculture shares with the FDA the role of protecting the nation's food supply. The Department of Housing and Urban Development influences the built environment and its impact on health. The Department of Energy plays important roles in setting radiation safety standards for nuclear power plants and other sources of energy. What roles do non-governmental organizations play in public health? Non-governmental organizations, or NGOs, play increasingly important roles in public health in the United States and around the world. The United States has a long tradition of private groups organizing to advocate for public health causes, delivering public health services, and providing funding to support public health efforts. In recent years, these efforts have been expanded globally as well. The American Red Cross and its network of international affiliates represent a major international effort to provide public health services. The organization plays a central role in obtaining volunteers for blood donations and ensuring the safety and effectiveness of the U.S. and the world supply of blood products in collaboration with the U.S. Food and Drug Administration. International NGOs such as Doctors Without Borders and Physicians for Social Responsibility have been active in advocating for public health efforts, seeking funding for public health needs, and addressing the ethical implementation of public health programs. Many private organizations, such as the American Cancer Society, the American Heart Association, March of Dimes, etc., provide public health education, support research, develop evidence-based recommendations, and provide other public health services. Other international NGOs such as the Oxfam and CARE are examples of the types of organizations involved in global health-related crises. Private foundations such as the Gates Foundation, the Kellogg Foundation, and Robert Wood Johnson Foundation have all played key roles in advancing public health efforts in areas ranging from nutrition to tobacco control to advancing new public health technologies. How can public health agencies partner with healthcare to improve the response to health problems? Clinicians and public health professionals increasingly share a common commitment to evidence-based thinking, cost-effective delivery of services, providing quality services to the entire population, and eliminating health disparities, and using computerized and confidential data systems. Community-oriented primary care, or COPC, is a structured effort to expand the delivery of health services from a focus on the individual to include an additional focus on the needs of communities. The concept of COPC is widely accepted as an approach for connecting the organized delivery of primary health care with public health. How can public health take the lead in mobilizing community partnerships to identify and solve health problems? An essential service of public health is the mobilization of community partnerships and action to identify and solve health problems. Increasingly, community members themselves are becoming active participants in addressing health and disease in their communities. One of the ways to engage community members is through community-based participatory research, or CBPR. Through CBPR, community members are involved in all phases of the research process, contributing their expertise while sharing ownership and responsibility over the research and assisting to build trust, knowledge, and skill to facilitate the research and development and implementation of interventions. Examples of successful collaboration include state tobacco control programs that have been led by public health agencies but rely heavily on non-governmental organizations, healthcare professionals, and other governmental agencies. These efforts have been able to substantially reduce statewide cigarette smoking rates. It is also possible to view the coordinated mobilization of public and private efforts as community-oriented public health, or COPH. We can see this as a parallel to COPC. In COPC, healthcare efforts are expanded to take on additional public health roles. In COPH, however, public health efforts are expanded to collaborate with healthcare delivery institutions as well as other community and other governmental efforts. You can learn more about CBPR and COPH approaches by using the links provided on this slide. This slide concludes the lecture presentation for today.